Okay, Assalamualaikum and good afternoon. Welcome to another Facebook Live session. Today we're going to talk a little bit about the myths surrounding diabetes, and a lot of people have different ideas about what diabetes is really about. So I'm going to try and talk you through some of these myths. It may not be a complete list, but these are the questions that I often get asked in the clinic. So we're talking about the common beliefs as well as myths. Now, before that, what we have to realize is that 1 in 2 adults in Malaysia are either overweight or obese. So a lot of these are, half of these are females, and the majority are actually of Indian ethnicity. And if you look at abdominal obesity, well, again, females more likely to have abdominal obesity, as well as Indians being more likely to have this problem. So this is the pattern which we see in Malaysia. And the problem is that diabetes is getting worse, and it's all related to lifestyle. So I'll expound on this. I'll talk about this as I go through the talk. Now, myth number one, type 2 diabetes tidak bahaya, not dangerous. And I don't need any medications kerana I think, type 2 diabetes tidak bahaya, so saya tidak perlu makan ubat. Now, this is a big mistake. We have two or three types of diabetes: type 1, type 2, and diabetes in pregnancy. When you talk about type 1 diabetes, it doesn't mean this is the first kind or the worst kind or the best kind. Type 2 diabetes is what we commonly see amongst all our patients. So 95% of our patients have diabetes. And type 2 diabetes is more difficult to treat because it is associated with a lot of complications of diabetes. Whereas type 1 diabetics know from the very beginning they have to be on insulin. Type 2 diabetics do not feel anything. So a lot of times you actually get diagnosed very late. And because of this and the lifestyle changes that I was talking about, you're seeing a significant increase in the number of diabetic patients in Malaysia. In fact, we are now at a level of diabetes, which the International Diabetes Federation said we would be in 2030. So we are 10 years ahead in terms of the numbers. And the reason for this is that, as I said before, type 2 diabetes is a disease of complications. It can lead to blindness, it leads to kidney disease, strokes, etc. So do not for a minute think that if you have diabetes, you can take this lightly. It is a serious problem associated with a lot of complications. And, in some of the surveys that we have done in the past, these are older figures, but at least 1/5 of patients may already have complications. Half have eye disease, more than half have nerve damage. That means you feel like tingling or numbness in the hands and legs. 50% of dialysis patients in Malaysia are from patients who were originally diabetic, who neglected their diabetes. And late complications, heart disease, etc., very, very common. So diabetes in itself, yes, the sugar is elevated, but when you leave it uncontrolled for too long, it actually causes a lot of problems. And if you look at this survey that was done in Malaysia, out of 180,000 patients with diabetes, as well as coexisting medical problems, hypertension, a lot of these patients had high blood pressure, a lot of patients had high cholesterol, they were either obese or overweight, and their were not controlled. So when you put one, two, three, four together, this is a recipe for disaster because this is ripe for heart disease. And a lot of diabetics may end up as a first presentation of their diabetes in an emergency department with a heart attack as their first sign that they have diabetes. So it is very, very important that we need to treat. And why do we treat? Because we know for a fact that treatment improves outcome. So don't for a minute let anyone convince you that if you have diabetes, you don't need to be treated. Treatment improves outcome. And we know from studies that every 1% of HbA1c that you go down and you sustain it over 10 years, we can reduce your rate of death, we can reduce your complications, we reduce the rate of heart attacks. So this is the reason why you need to start medication as soon as possible. And don't even imagine that you can do it without medication, because it's very, very unusual for patients to be able to change their lifestyle significantly enough to actually make a difference. So this, for example, is a patient who had a below knee amputation. This is a diabetic foot. This man went walking barefoot outside his house and then stepped on something and this happened. This is a gangrene of the toe. So a lot of diabetics, after a while, end up losing toes and end up having amputation as a result of their poor diabetes control. This is a normal eye, and this is an eye with a lot of damage from uh, diabetes. The blood vessels have become swollen, and these blood vessels here can burst. And when they burst into the retina or into the vitreous area, which is the solution in the eye, you can actually go blind. And diabetes is the leading cause of blindness. And this is severe diabetic retinopathy as a result of poor control. This is a cataract, which of course can be fixed quite easily. And this is an aorta specimen of a patient who has all these fat deposits, etc. here. So this patient would have died of a heart attack because of blockage and so on. So it's very important. I hope I've convinced you that treatment needs to be done early, and you need to be on treatment. Okay, next myth. Penderita diabetes biasanya gemuk, overweight atau obese. So for most part, it is true. The diabetes rates are going up together with the obesity rates in Malaysia, and insulin resistance drives the diabetes epidemic. Yes, we know that. But the fat distribution is important. So when you are fat, you find that there is all this white stuff inside your tummy. This is called visceral fat. And visceral fat is dangerous because it actually creates insulin resistance. And this is what leads to diabetes. So this is why we try and measure central obesity and so on. We have waist circumferences. So in women, we try and keep it below 80 centimeters, in men below 90 centimeters if possible. But there is this concept of toffee, thin outside, fat inside. So what it means is that although you may look very thin, but in actual fact, all the internal visceral fat is actually quite significant. And this visceral fat is the one that makes the problem. It creates insulin resistance, it creates the diabetes, and so on. So you find that, for example, if I was to take a Caucasian with a certain weight, and I take an Indian with a certain weight, the same weight, and I take a Malay and I take a Chinese man, you'll find that the Caucasian and the Chinese have less visceral fat as compared to the Indian or the Malay. So because of this problem, you find that they are at risk, higher risk of developing heart attacks at the same body mass index. So this is why we have to be careful. And this concept of toffee is quite interesting in that you may look perfectly thin, but you might actually have a lot of belly fat, which may lead to problems. Next myth, diabetes itu penyakit orang tua. Now, if you look at our Malaysian statistics, now this is the younger age group. That means below 29, below 30. And you find that a significant number here actually are young. What is young for us? Okay, less than 40. You find that a large number of our diabetics are actually less than 40 years old. Now, if you look at Hong Kong, for example, in Hong Kong, diabetes patients, they have diabetic patients as young as 3, and 1/5 of their diabetic patients were actually under 40. So diabetes, when I went to medical school, was a disease of the old. Type 2 diabetes was, something your grandmother got in later life and all that. But nowadays, we're seeing 3, 4-year-old kids getting diabetes. So this is the problem. And when you develop diabetes as a young child, the risk of complications is much higher than if you develop it later on in life. And this is why we have to be very careful as far as our children are concerned and diabetes, because diabetes risk is real. Children are more prone because there's lifestyle, they don't cycle, they don't do exercise, there's more TV, there's more PS4, there's diet problems. You tend to because it's so easier to buy economy rice or order a McDonald's burger on Grab Food and so on. So obesity in children is actually quite common, and children nowadays are very sedentary. They don't have much exercise, especially this MCO hasn't helped in the last 1.5 years. Myth number 4, ubat diabetes akan merosakkan ginjal or buah pinggan. Now, this is something that almost every single patient that comes to my clinic will tell me, oh, saya takut nak makan ubat because they're scared that the diabetes medication may damage their kidneys. No, but what I've tried to show you is that it is the diabetes that actually damages your kidney. It's not the medication. Or because of that, they tidak mau makan ubat, don't want medication. Or alternatively, they tell you that, oh, doctor, okay, I accept the fact that I need medication, but you can only give me one or two medications. It's like, you are telling me my hands are tied. I'm giving you a medication. The medication may not be enough to control your sugar, but you won't let me give you any more medication because you're scared mengurangkan beban kepada buah pinggang. So you don't want to stress your kidneys out. But what actually happened is that it is the diabetes that eventually will cause problems. So this is why we have combinations of pills and so on. So a lot of the medications you take, two tablets maybe or three tablets may be combined. For like blood pressure medicines, etc., may be combined with two, and then they have a diuretic or whatever it is. Same thing in diabetes. We have combinations, what we call the fixed dose combination, and this helps reduce your pill burden. Now, if you think about diabetes, what we actually try and do is we start with one, we add a second, we add a third. In Malaysia, you can add a fourth, and then we go on to insulin. That's your fifth. We do not usually remove medications. We add medications as time progresses because we know that diabetes is actually a progressive disease. So when it's progressive, at the time when you're diagnosed with diabetes, half your pancreas doesn't work anymore. Your beta cells, 50% of your beta cells are not working in the pancreas. So it means that within 10 years, it's very likely that a lot of patients will require insulin. So we try and keep the sugar as low as possible, and we add as many medications as possible to try and get control. Now, the next thing is semua ubat gula sama saja, tak perlu tukar-tukar ubat. Now, when the patients come to my clinic, what you realize is that for diabetes to occur, there are many pathways. This is called the ominous octet. Ralph DiFronzo, the guru of diabetes, actually coined this, and he said that, look, there are 8 different ways that a person can get diabetes, or the diabetes can worsen. There is too much hormone being produced. There's not enough insulin. There's insulin resistance because there's too much fat. The kidneys don't work so well, etc. So what we do when we treat diabetes is we take different combinations of medications to combine them. We do not use 2 medications of the same class. So we use 4 different medications of different classes to attack different pathways. And in that way, we help you actually try and get good control. Ubat tradisional and akar kayu berkesan dan mujarab untuk rawat diabetes. So here we are, we're looking for the perfect medication. This was the man who helped the Malaysian government look for MH17. And he wasn't very successful, and we're looking for the perfect medication. Now, what I want to tell you is, if you think about herbal medications, metformin, which is the first drug we use in diabetes, was actually developed from this plant called Galega officinalis. So when patients tell me they want to take herbal medicine, I say, yeah, well, okay, go ahead, take metformin, it's herbal. But what you have to realize is that when we treat someone with diabetes, we are now trying to say, look, I'm giving you a medication, it's going to reduce your HbA1c by X number of percent, and this will help you maintain your sugar level over many years. But if you're taking akar kayu lah, you're taking some broccoli, some people take peria, some people take all kinds of things. If you take those, there is no scientific, I don't know how much peria to give you to reduce your sugar by 10 or by 5 or whatever it is. So how do I maintain your sugar level at a level which is safe for you so that you don't have complications if I cannot gauge? So there are a lot of herbal remedies. There are a lot of things. You can go to Shopee or Lazada. I mean, you can buy a lot of stuff there which promise you that they will control your sugar. But if you are willing to actually buy those things, why not actually take something that works and has been proven to work in clinical trials? So this is what we tell our patients. Jangan tergoda dengan apa yang lihat di internet, because sometimes it may not be true. Okay, now next question, next myth. Boleh berhenti ubat kalau sudah normal. Now, what you have to understand is that, as I told you before, there is a progressive decline of your pancreatic function. So your pancreas is not producing enough. So no matter which medication I add, whether it's a sulfonylurea, whether it's diet, whether it's metformin, etc., eventually the diabetes will still progress downwards. So when I get you to control using one, two medications, this is because the medication is working. It's not because you are cured. Diabetes is not like the flu or a blocked nose. You take one tablet and that's it. Your blocked nose goes away. You got a headache, you take Panadol and it goes away. It's not like that. It is a long term, lifelong commitment to taking medicines. And stopping the medicine means that your sugar levels will go back up. So all the effort you have put in the past would have disappeared because you did not take your medication properly. So next, insulin itu bahaya. Satu kaki sudah masuk kubur, sakit, susah, sulit, whatever. So most patients who, when we talk about insulin, they imagine this is a man carrying a taipusam kavadi. So all the needles in his back. This is what patients imagine what the needles are like. But in actual fact, oops, this is me injecting myself. This I did this in the clinic. What was it on Saturday morning, trying to prepare this lecture, and there is a hole here where the needle came out. There is no blood gushing. I'm not bleeding to death because I poked myself with this needle. The needle is very small. It's 24 gauge and it's a 4 millimeter needle. It hardly feels anything. In fact, if you use one needle a day and you change it frequently, you will not feel the prick of the needle. So many times when I actually teach patients how to do insulin injections, the first reaction is they'll tell me, "Oh, anekhwanya." Anekhwanya means, "Oh, lade onia." So when you realize it, in actual fact, it is not, it is nothing. But all the hype, all the fear mongering that people get because of this, puts people off insulin. Now, insulin is not the end. We use it for good sugar control. We use it in type 1, type 2, and we use it for children. This is from the ISPET, the International Society of Pediatric Endocrinology website. Now, if we can give it to children, surely we can give it to adults. It is safe. Insulin is no longer from, oh, dari babi. We do not have porcine insulin or bovine insulin anymore. All the insulin we use now, disahkan halal, and it is actually safe to use with very little reaction. So insulin is safe. There are many pen devices, etc., that are easy to use. I'm going to put up another video, just a short clip demonstrating this, how it is to inject and so on. I'm not promoting any of these insulins, but these are the ones that we commonly use in practice. And over the years, there are many different types of injectables, including GLP-1 receptor agonists. This is a newer class of injectables. So there are many different types of injections, and injection does not equal insulin. Okay, next question. I always see patients who come to my clinic and they tell me, "Oh, doctor, I've stopped your medication, but I've started taking honey." How do you do? Well, anyway, honey, of course, is good. It's very tasty, and there are different quality of honey, different grades. So you find that the Manuka honey is supposed to be the best. It's got anti-inflammatory properties and so on and so forth. But what you don't realize is that honey is typically 80% sugar. So in diabetes, we talk about an exchange. Every day, you are allowed to eat a certain number of exchanges per day. So in most females, it's 10 to 11, maybe 12. In males, it is maybe around 15 to 18. Now, one exchange is 15 grams of carbohydrate. So 15 grams of carbohydrate spread through the day is what you are allowed to take as a normal, as a diabetic individual. Now, honey, one tablespoon of honey is already one exchange. So you take 15 tablespoons of honey, that's your whole day's quota gone. Finish lah. It has no sugar, no fat, no protein, and it is basically simple sugars. So when you take it, it actually does get absorbed fairly quickly, but slower than sugar. So complex sugars, etc. So the question is, how much can you take, or should a diabetic person eat safely? Well, basically, once in a while, if you take a small teaspoonful, probably it doesn't matter. But like anything else with diabetes, you have to be careful. The same applies for fruits. When you take fruits, everybody says, oh, fruit is healthy, ma, so I can eat as much fruit as I want. No, one portion of fruit, for example, one slice of watermelon is one exchange. You are allowed only 2 to 3 exchanges per day of fruit. That means you're allowed only 3 or 2 slices of bread, of fruit. So making juice, for example, is the same. Oh, I make juice and then I add honey to sweeten it. What you're doing is you're giving yourself too much sugar and carbohydrates. So really what you need to do is if you have doubts about honey or anything else that you're eating, tell your doctor, because we can actually refer you to a dietitian to counsel you and tell you what to do. Okay, the last few. Myth number 10, pesakit diabetes tidak boleh diberi vaksin COVID. Now, this is something that's quite frightening, because when you think about it, diabetes puts you into a high risk category. If you get COVID, you are very likely to get a severe form because your body's immune system may not be so good, etc. So a COVID vaccine is the only way that you're going to get protected. This is Ministry of Health data. Okay, if you have a number of people who've been vaccinated, AstraZeneca, Pfizer, Sinovac, and look at how effective it is. If you're partially vaccinated, less effective, but still effective, 75%, whatever it is. And this is, you're talking about the number of deaths here. Okay, if you're AstraZeneca, Pfizer, Sinovac, these are the number of deaths, as opposed to the total number of deaths here, which is 13,000 something. So if you look at the number of people who are unvaccinated who are dying, it's much higher than people who have been vaccinated. So diabetes puts you on a fast track for vaccination. You should be vaccinated. It goes for any chronic illnesses, and there's only very few reasons why people should not be vaccinated. And the only one I can think of off the top of my head is actually allergy to the product. Other than that, if you're on some medications like steroids in high doses or immunosuppressive drugs, then they say, well, maybe you can delay your vaccination. But other than that, everybody should be vaccinated. Pesakit diabetes tidak boleh bersenam. I have diabetes, therefore I cannot exercise. That's again ridiculous, because diabetes and exercise go hand in hand. Weight management, sugar control is all actually part and parcel of lifestyle. So your lifestyle changes, diet, exercise will help you manage your diabetes better. But if you've never exercised before, please consult your doctor before you start exercising. If you haven't exercised before, don't next day go and participate in a 50-kilometer marathon, full marathon, because you may die of a heart attack or something. Get checked out first. If your doctor is happy that you can exercise safely, then by all means, exercise. There are many professional sports people who are diabetic, football players, cricket players, etc. So diabetes doesn't mean you cannot exercise. So my final slide, what are the priorities in diabetes treatment? And really, if you remember this movie, it's called The Titanic. That's Kate Winslet when she was very young, and this is Leonardo DiCaprio in one of his first movies. Now, the reason I like this slide is because you imagine you're the captain of the ship, captain of the Titanic, right? And type 2 diabetes is the iceberg that's in front of you. What you are seeing is the tip of the iceberg. That means just that 1/9, 1/10 of the iceberg that's sitting above the water. There's a whole lot of ice under the water that you don't know about. And this is what diabetes is about. So really, you should be controlling your diabetes, because diabetes has a lot of problems that you don't realize. It's like the Titanic hitting the iceberg, okay? So you have to make sure that you prioritize. And the priority is that you have to look after everything: cholesterol, blood pressure, stop smoking, control your sugars, and make sure you have an adequate, healthy lifestyle. So I hope I've answered some of your questions, some of the common myths that I actually deal with in practice. And I guess it's time for questions. Thank you. Macam mana saya nak persuade my old father who needs insulin but refuse to take one because he's scared of needles regardless how small it is? Okay, this is quite challenging, and some people biasanya tidak mau. You can tell them whatever it is, they won't listen. I see a lot of patients like that in my clinic. And what we do is I actually do the first injection in my clinic. Okay. So what I tell them is, look, I've injected myself. I show them. Then I say, okay, Pakcik, I'm going to cucuk sekarang ni, nak cucuk perut you. Kita try tengok macam mana. So I cucuk. And the first reaction will be, oh, macam tu je. And you already won the battle. So once they actually inject, they try it, then they'll say, okay. And what I tell patients is, look, I make a deal with you. Try it for 1 month. If after 1 month you don't like it, then okay lah, at least we've tried. Then I can feel satisfied that I've tried. So that's how we do it. Macam mana saya nak tahu kalau saya perlukan insulin? Okey, keperluan insulin itu biasanya adalah keputusan doktor. Kita tidak sendiri sebagai pasien membuat keputusan bahawa saya perlu insulin. Tapi gejala-gejala yang biasanya mengarah ke insulin itu, kekurangan insulin dalam tubuh, satu, berat badan turun. Kedua, kita ada gejala what we call decompensation. That means diabetes itu menyebabkan banyak gejala seperti kencing malam tu bangun 3-4 kali, setiap hari kita ada polyuria, kita kencing, berat badan kita makin lama makin susut. So, semua ni adalah gejala bahawa okay, gula itu tidak terkontrol. Satu lagi kita akan periksa darah dan lihat HbA1c. Itu adalah rata gula untuk 3 bulan ke belakang dan biasanya kalau lebih daripada 9 atau 10, walaupun makan ubat dengan teratur, jaga makan dan sebagainya, dan maksud dia pasien perlukan insulin. That's it. Okay. Thank you. Terima kasih.